The Centers for Disease Control released a new statistic in April. It showed 1 out of 36 children now suffer from autism. That was for the year 2020. When we look at that number 2 years ago, it was 1 in 44. And when we look back to the year 2000, it was 1 in every 150 children. Many people have been arguing that it's because we have much better screenings and diagnostic practices. So the numbers are increasing because we can detect autism better than we used to. But these surging numbers defy this simplistic explanation. Current understanding is that autism depends on your genetics, so there's nothing you can really do about it. But a meta-analysis of 25 autism studies could shift this understanding. It could fundamentally change the focus of research into the cause of autism from genetics to some factors that are external, maybe in your environment, and that's important. That shift could open up new revolutionary avenues for potential treatments. But how does this work? Does that mean we can treat autism, or at least decrease the severity of the symptoms? Welcome to Frontline Health. I'm Dan Skorbach. Autism has been connected to more than 100 genes so far, but the puzzle has gotten more complex with environmental associations that seem to keep growing.
Actually, it's interesting they have to do all this study to discover that. We know almost all the chronic disease is epigenetic, meaning they have a genetic predisposition, but they're always affected by environmental factors, because environmental factors can regulate the genetic expression. So that's why even people have identical genetic features, they don't necessarily develop the same kind of disease, or they have the same severity of the same disease. The environmental factor actually starts from very early on. Actually, the time when a baby is conceived and how they are supplied with nutrients. Some embryo will have trouble to get sufficient amount of nutrients because their attachment to the uterine is affected. And if mother suffers from a diabetes or other health problem, it also affects the risk of the autism development. From Chinese medicine perspective, it's not just the chemical nutrition, and it's energetic support to the fetus, and the energetic status of the mother have a lot to do with the development of the brain. So therefore, definitely have an impact on the development of autism.
So if we take care of our bodies, the bad genes stay closed and the good ones flourish. And how would we know that for sure? Well, we can't, because there's a big problem with research itself. Scientists mostly focus on genetics and not the environment. Kiran Krishna, a microbiologist, he told the Epoch Times that what appears to be coming is similar to the global realization that smoking was causing cancer. The tobacco industry eventually couldn't stop the number of small cumulative studies that clearly documented the link of smoking to lung cancer. Mr. Krishna said that the same thing is happening regarding the connection between the gut microbiome and autism. And this new meta-analysis study we brought up earlier is important because it will show that there's a close connection between autism and external factors that need to be studied. This can help other researchers attract grants and funding to look more intentionally at microbes and how they can have an effect on autism. Of course, this is just a small step in the right direction because there are many factors that can contribute to autism. Some doctors are even connecting the explosive growth of autism to the explosive growth of vaccine requirements over the last few decades. There's a discussion for another video though. But the question remains, what's more important, your genes or the environment? We asked Dr. Yang.
The environmental factors are more important because that's the part we could help. For example, heavy metal toxicities, and dysbiosis and inflammation in the gut, methylation imbalance, and overloaded copper and deficiency in zinc, and essential fatty acid imbalance, and vitamin D deficiency, and chronic infection or inflammation. Well, this is only from the biochemical or modern medical perspective, but from the Chinese medicine perspective, which is a medicine for human energetics, provide us additional understanding and insights of how autism developed and how we can diagnose and treat them with totally different approach that actually complement very well with our biochemical and behavioral therapies.
Dr. Yang has had some success in treating autistic children and adults. That's why he is convinced that your fate is not written in your genes.
If we address those issues, their function improves regardless what their genetic makeup is. Today, there's a lot of mistake by people when they're testing people's genetics, think the genetics determine things. No, genetics only tell us whether or not that person has a vulnerability or susceptibility or risk of having problem. It doesn't tell us they have that problem. Therefore, there's always additional biochemical marker we need to use to evaluate what exactly happened to this person due to those genetic factors.
So when these issues are measured, analyzed, and addressed, patients can improve to various degrees.
When we address those issues, we may not be able to cure autism or Asperger's syndrome, but we definitely see a dramatic improvement with the ability to communicate, speak, and to function. From 4 years old to begin to have eye contact, they began to speak a lot more words and more expressive verbally and non-verbally. And for adult patients who can improve from being very isolated, paranoid, and socially awkward to run for president of Rotary Club and to begin to learn how to sing and to sing in front of other people. And that's a huge change can happen if we address those issues.